Chapter 25. Health Informatics and Information Management. Key terms. Current Procedural Terminology, 4th edition, CPT 4. Comprehensive listing of medical terms and codes for the uniform designation of diagnostic and therapeutic procedures, used in the United States for coding for physician reimbursement in hospital outpatient and ambulatory surgical procedures. Electronic Health Record, EHR. A longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Included in this information are patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. Health Information Management, HIM. The allied health profession built around the management of the healthcare record in its physical form, as well as the management of data and information within the medical record. Health Informatics. The interdisciplinary field that studies and pursues the effective uses of biomedical data, information, and knowledge for scientific inquiry, problem-solving and decision-making, motivated by efforts to improve human health. Health Insurance Portability and Accountability Act of 1996, HIPAA. Federal legislation passed to improve the efficiency and effectiveness of the healthcare system. Components that affect health information include privacy, security, and the establishment of standards and requirements for the electronic transmission of certain health information. International Classification of Diseases, 10th Revision, Clinical Modification, ICD-10-CM. The classification system that replaced ICD-9-CM, Volumes 1 and 2 on October 1, 2015. This classification system is used for diagnosis coding in all healthcare settings in the United States. Medical necessity. Healthcare services or supplies that are needed to diagnose or treat an illness, injury, condition, disease, or its symptoms. Revenue cycle. The process of patient financial and health information moving into, through, and out of the healthcare organization, culminating with the healthcare organization receiving reimbursement for services provided. Health Informatics and Information Management. Hospitals, ambulatory care facilities, physician practices, emergency and trauma centers, rehabilitation centers, long-term care facilities, home care programs, and all other healthcare settings maintain health records. Although these settings vary with regard to the type and range of medical and health-related services they provide, they all have a common need to concentrate, within a single record, all patient care information that applies to an individual patient. Information management is focused on ensuring that the data and information that is collected and documented into a patient care record is managed and maintained to ensure communication among caregivers, is available when and where needed, and is secure from unauthorized access. Health Information Management, HIM, is the allied health profession built around the management of the healthcare record in its physical form, as well as the management of data and information within the medical record. Every healthcare institution needs a department that has been organized and staffed to provide adequate health information management systems and practices. These systems facilitate the collection of health information, ensure complete documentation, maintain health data, and protect the content of the record against unauthorized disclosure. The functions of the HIM department are service-oriented and support the optimal standards set forth for quality of care and services in the health institution. The services of the HIM department vary according to the type of institution, but there is a commonality in that all departments maintain the patient record. Health information managers are tasked with ensuring the availability, accuracy, confidentiality, and the security of patient records to assure the quality and continuity of care. Health records are commonly electronic, but any paper can be scanned and stored as digitized images. There may still be hard copy medical records but are more likely to be found in smaller medical practices. The HIM department supports the current and continuing care of patients, the institution's administrative processes, patient billing and accounting processes, medical education programs, medical research, utilization management, risk management, and performance improvement programs, privacy and security issues, and legal requirements. Clinical decision-making and financial reimbursement depend on the information contained in the health record, therefore maintaining a complete and accurate record is essential. An error in recording the medications administered to a patient, for example, might lead to a life-threatening situation. An error in data reporting could result in patient harm as well as a sizable financial loss for the healthcare institution. As a result of the growth in electronic health record, systems, health informatics has emerged as an interdisciplinary field. There are many definitions of health informatics, but for purposes of this chapter the definition used here is the interdisciplinary field that studies and pursues the effective uses of biomedical data, information, and knowledge for scientific inquiry, problem-solving and decision-making, motivated by efforts to improve human health. Wager et al., 2013. Health informatics is the overarching field that pulls computer and data science, big data, information technologies, health information management and data analytics all into one, focused on improving health and healthcare. Informatics seeks to improve outcomes, lower costs, increase patient safety, and promote high-quality services. Although there are five areas of informatics, clinical informatics is utilized every day by the imaging professional in caring for patients. Clinical informatics is also referred to as applied clinical informatics or operational informatics and is essentially the application of informatics and information technology to deliver healthcare services. Radiology uses clinical informatics in the generation, manipulation, management, integration, and delivery of visual images. Patient records are primarily electronic, although there are still small physician practices, and other smaller healthcare organizations still utilizing a paper-based medical record. The electronic health record systems are built, updated, and maintained by computer and data scientists. Other information technology specialists are involved with programming, building of databases, constructing networking technology, and cybersecurity infrastructure. Health information managers and all members of the healthcare team work side by side with these technology professionals to ensure databases are built to collect required data, templates are built to ensure ease of data entry, information that is output is clear, legible, and easily understandable by end users. The goal of information management is to ensure that the technology in use can acquire, analyze, transmit, and store data in a secure setting. This includes an organization's financial and administrative data, as well as clinical data. Medical record management. Electronic health record, EHR. The electronic health record, EHR, has significantly altered how health information is managed. According to the Health Information and Management Systems Society, HIMSS, 2015, this organization defines the EHR as a longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Included in this information are patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. The EHR automates and streamlines the clinician's workflow. The EHR has the ability to generate a complete record of a clinical patient encounter as well as supporting other care-related activities directly or indirectly via interface including evidence-based decision support, quality management, and outcomes reporting. Elements of the health record. The Health Information Manager is responsible for ensuring a complete health record and is responsible for guiding the development, review, and updates of organizational policies for documentation and management of the health record. The federal conditions of participation and state departments of health are the regulatory bodies that provide guidelines to develop organizational policy. Facilities that hold special accreditation by the Joint Commission or the Healthcare Facilities Accreditation Program, for example, also have specific guidelines for medical record creation and documentation. Those standards also must be reviewed and incorporated into organizational policy. Master Patient Index. The Master Patient Index, or MPI, is an electronic file that identifies all patients who have been admitted or treated at a healthcare organization. All patients registered to receive care as either inpatients or outpatients, including referral, clinical, emergency care, home care, or other care provided by the facility, are listed individually in the MPI as the key to locating patient records, whether in paper or electronic format. A complete and accurate MPI is a crucial part of an institution's patient information system. The MPI identifies all patients who have been treated in the healthcare facility or enterprise, as well as the health record number associated with the name. In this age of integrated healthcare delivery systems, maintenance of an accurate MPI is more important than ever. The MPI is a crucial informational link in the development of the National Health Information Network, health information exchanges, the establishment of multi-hospital systems, and the vertical integration of hospitals, physician practices, home care agencies, and long-term care and other non-acute care facilities. In these environments, it is particularly important to facilitate mergers of various indexes to create an enterprise-wide MPI that provides access to longitudinal patient records. The longitudinal record includes all health and illness data collected on an individual from birth until death. The result of data mergers should be an accurate and effective MPI that links the patient to facilities within an organization or enterprise and across patient care settings. A strong information governance program must include master patient index maintenance. 2 levels of data elements should be included in the MPI: 1. Demographic data and 2. Visit level data. The demographic data contain identifying information about the patient. This information should be verified during registration for each visit and updated as needed. The visit level data include information that changes with each encounter. The American Health Information Management Association, AHIMA, 2010, suggests that the minimum data set for patient identification in the MPI include the following information. At the demographic level: internal patient identification medical record number, person name legal name, including surname, given name, middle name, or initial, name suffixes and prefixes. Date of birth, birth date by month, day, and 4-digit year. Gender. Race. Ethnicity. Address by street, city, state, and zip code. Telephone number. Alias previous maiden names. Social security number. Facility identification. Universal patient identifier, when established. At the visit level: account number, visit number. Admission encounter visit date. Discharge or departure date. Encounter or service type. Encounter service location. Encounter primary physician. Patient disposition. These data elements should be accurately matched with persons being registered to minimize duplicate records within a facility and across patient care settings. Provisions should be made for the correction of errors in a name or date of birth, for cross-referencing name changes, such as a change in a woman's surname upon marriage, and for the use of hyphenated names. When duplication errors are discovered, new numbers must be issued to all but one of the duplicate patients, and corrections must be made throughout the various health information systems. The MPI is the key to electronic data repositories and integration of all information across the continuum of care. Thus, the data in the MPI must be organized in such a way that it is complete and accurate and is maintained in a manner that ensures the protection of patient privacy. History and physical. The history and physical provides detailed information of why the patient is being seen for the current episode of care, their medical history, physical examination, a clinician's impression or diagnosis, and a plan of care. There are specific documentation requirements for a complete history and physical that are required by licensure and accreditation agencies, but also for physician reimbursement. The following documentation elements are typically documented by clinicians. Chief complaint, CC. Statements by the patient of signs and symptoms that caused them to seek medical care, for example difficulty breathing and shaking chills. History of present illness, HPI. A chronological description of the development of the patient's illness. For example, 2 episodes of shaking chills lasting a few minutes, temperature of 96. Second episode at 8 p.m. No fever. Review of systems, ROS. A systematic inventory of all body systems, as reported by the patient, which is helpful to the clinician that may identify other symptoms. For example, denies vomiting, diarrhea, rash, no other findings noted by patient. Past medical history, PMH. Summary of patient's past illnesses, surgeries, pregnancies, allergies, and current medications. History of pneumonia. For example, no known allergies, vitamin D daily. Family history. Illness and diseases among past or current family members that may have an impact on the patient's current health status. For example, family history diabetes on father's side. Social history. Marital status, education level, occupation, home environment, dietary, sleep, exercise patterns. Use of alcohol or tobacco and other social determinants of health. For example, single, college student, uses alcohol socially, lives alone in off-campus housing. Physical examination. Performed and documented by clinician that may include all body systems or body systems relevant to a clinician's specialty. For example, fever 103.9, heart rate 160, pulse oximetry 93, weight 170. CV, S1 and S2, no murmurs, gallops, or rubs lungs, wheezing noted bilateral. Impression or diagnosis and treatment plan. A possible list of diagnoses is documented along with a treatment plan. For example, possible viral infection, bacterial infection, rule out pneumonia. Chest X-ray, CBC, Chem 20 CMP, blood culture, urinalysis. Healthcare organizations have policies in place that state a specific time frame completion of the history and physical, which is no more than 24 hours after a patient is admitted for inpatient care. In outpatient care settings, completion of this document is done at the time of the encounter. The clinician is responsible for electronically signing and dating the document. Operative report. An operative report is a description of the details of a surgical procedure. This report is to be written or dictated by the surgeon immediately following surgery and should be made available in the patient's medical record as soon as possible. The following details are included in a written or dictated note. Surgeons and assistants. Names of surgeons and any assistants involved in the surgery. Preoperative diagnosis. The diagnosis and the reason for surgery. Postoperative diagnosis. The diagnosis determined after the procedure has ended and what was found. Procedure. Name, S, of the procedures performed. Anesthesia. Type of anesthesia administered. Description of the procedure. A detailed note by the surgeon from the beginning of the procedure to the end, including findings, any tissue removed, estimated blood loss, complications, if any, condition of patient upon transfer to recovery. The surgeon is responsible for electronically signing and dating the document. Ancillary reports. Results of all ancillary studies are a part of the patient's health record. These studies include imaging studies, laboratory work, pathology reports, and any monitoring or tracings of body functions. Laboratory results are generated electronically by automated testing equipment. The results become part of the patient's health record. All imaging studies and pathology reports must be signed and dated by the physician who interpreted the reports. The completed reports are then available for review in the electronic health record. Most information systems also have the capability to store images, scans, and video for review by other clinicians. It is important to ensure that any tests completed have a corresponding report in the health record. Problem lists. A problem list is created and managed in the electronic health record through a combination of sources. Problem lists facilitate continuity of patient care by providing a comprehensive and accessible list of patient problems in one place, AHIMA, 2011. Problem lists frequently include a patient's illnesses and injuries that should include a date of diagnosis and a date of resolution, if resolved. The problem list can be reviewed by clinicians to get a quick picture of a patient's health. Maintenance of these lists can be a challenge. Policies should be in place to designate who is responsible for reviewing and updating the problem list, but often this is a cumbersome process. More work needs to be done with electronic health record systems to create more efficient problem lists. Physician orders. All treatments and procedures, or medications to be administered to a patient require a physician order for the purpose of diagnosing a patient's illness or symptoms. Orders should include the test to be performed along with a diagnosis or sign or symptom. Physicians may send orders directly to an ancillary department through a computerized physician order entry system or CPOE. CPOE systems are generally integrated with clinical decision support, CDS, systems, which has significantly reduced unnecessary and inappropriate imaging. CDSS have been incentivized since 2009 by the Federal HITECH Act, and by 2017 the majority of hospitals and outpatient clinics had implemented these systems. CDSS were initially used to prevent medication errors and later implemented to improve diagnostic accuracy. In 2014, the Protecting Access to Medicare Act, PAMA, became law and required the use of CDs for any advanced imaging exam. In January 2020, requirements for an appropriate use criteria, AUC, consultation prior to any advanced diagnostic imaging order was enacted for Medicare patients, and AUC consults must be documented for reimbursement. CDs helps providers engage patients in their care and can also be used to show why an exam may be unnecessary. Patient portals. According to healthit.gov, a patient portal is a secure online website that gives patients convenient 24-hour access to personal health information and medical records, called an electronic health record or EHR, from anywhere with an internet connection, Office of the National Coordinator for Health Information Technology 2017. It is common to have a patient portal integrated with an organization's electronic health record system. Patient portals are image-enabled using artificial intelligence to make technical and medical jargon accessible to patients. Patient portals typically include summary of visits including any inpatient or outpatient visits, medications, immunizations, allergies, ancillary test results, such as laboratory and imaging study reports, physician-documented notes, such as operative notes and progress notes, secure messaging with providers, prescription refill requests, appointment scheduling, verification of benefits and coverage, patient demographic data, ability to make payments, access to education materials, completion of forms. The Health Insurance Portability and Accountability Act of 1996, HIPAA, mandated that patients have a right to access their personal health information. This act also provides the patient with the right to request an amendment to their health record. Biederman and Dalzell, 2017. In December 2016, the 21st Century Cures Act, the Cures Act, made it mandatory for hospitals and health systems in the United States to provide patients with notes, reports, images, etc. through patient portal applications. Patient portals allow patients an easy and convenient way to be actively involved with their care. Patients can access records and results, schedule appointments, send and receive messages directly with their providers, request a medication refill, and portal use often saves time for both the clinician and patient. Revenue cycle management. According to Gordon, 2016, the revenue cycle is the process of patient financial and health information moving into, through, and out of the healthcare organization, culminating with the healthcare organization receiving reimbursement for services provided. This process has a beginning, a middle, and an end point that involves several departments, staff, and information technology. Medical necessity is part of the front-end process. Medical necessity is defined as healthcare services or supplies that are needed to diagnose or treat an illness, injury, condition, disease, or its symptoms and that meet accepted standards of medicine. Medicare.org, 2020. When a physician orders a diagnostic exam, the order must include a diagnosis or symptoms that supports the reason for the exam. Medicare, and many commercial payers require a pre-certification process that ensures the exam will be covered by insurance and meets medical necessity. Payers typically have a list of exams and procedures they will cover that include approved diagnosis codes. Registration personnel can often check to ensure that a diagnosis will meet medical necessity for an exam. When they are uncertain, a coder in the Health Information Department can perform this verification. If a patient presents for an exam and the physician order is lacking a diagnosis or a diagnosis that does not meet medical necessity, the provider should be contacted immediately. The diagnosis is critical to the payment and is the reason to justify or deny reimbursement. The middle process of the revenue cycle includes the process of clinical coding. ICD-10-CM, or the International Classification of Diseases, 10th edition, clinical modification, is the code set used for diagnostic coding. The diagnosis, symptom, or reason for visit that is documented by a physician is translated into ICD-10-CM codes. For example, a patient presents for a chest X-ray and the documented diagnosis is shortness of breath and cough. A coder would assign the following ICD-10-CM codes. R05, cough. R06.02, shortness of breath. CPT-4, or current procedural terminology, 4th edition, codes are used to code procedures for outpatient encounters and ancillary services such as radiology and laboratory. Radiology codes in CPT include diagnostic and therapeutic radiology, nuclear medicine, diagnostic ultrasonography, and radiation oncology. The codes numbers range from 70,010 to 79,999. For example, a chest X-ray has 4 codes, depending on the number of views taken. 71,045 radiologic examination, chest, single view. 71,046 radiologic examination, chest, 2 views. 71,047 radiologic examination, chest, 3 views. 71,048 radiology examination, chest, 4 or more views. Generally, the CPT-4 codes for radiology reside in a charge master. This is an electronic database that includes a master list of all services, supplies, devices, and medications charged for inpatient or outpatient services. Charge master codes must be correct to reflect the code and payment for all radiology procedures accurately. Radiology should work with both health information management and billing departments for charge master updating and maintenance. The back-end process of the revenue cycle includes claims processing and payment. A patient's bill will include the charges and CPT-4 code, S, that were entered by the radiology technician, the ICD-10-CM code, S, entered by the health information coder, which will then be submitted to the insurance company for payment. Medical necessity should already have been established on the front end of the cycle, where verification of the ordered exam and corresponding diagnosis were already reviewed. The bill will move through the process until payment is received and posted. Any follow-up or denial issues, excluding medical necessity, are handled by the billing department. It is vital to an organization's fiscal health that a strong and coordinated revenue cycle management process is in place to ensure that all procedures and exams performed are appropriately reimbursed. Communication between personnel and departments in all three phases of the revenue cycle process requires a consistent focus and effort to ensure optimal performance. The Health Insurance Portability and Accountability Act, HIPAA. Privacy Rule. HIPAA, enacted in 1996, was established to ensure the healthcare industry is focused on the need to protect health information from inappropriate access or use. HIPAA also supports the need for timely access to health information, and that the air remains secure and patient information remains private. There are 8 parts to the Privacy Rule. 1. Uses and disclosures of protected health information, FI, identifies how and for what purposes FI can be used and disclosed, and identifies requirements for authorizations to release information. This section of the Privacy Rule includes a minimum necessary standard that requires facilities to release only the specific information necessary to fulfill the purposes of the request. 2. Business associate agreements are required when a business associate performs business for a covered entity. For example, an independent billing company provides billing services for a radiology group. 3. Notice of Privacy Practices, NPP, inform patients of how their health information may be used or shared and how patients can exercise their privacy rights. 4. Right to request privacy protection establishes a patient's right to restrict the use and disclosure of their FI. 5. Right of access to health records establishes a patient's right to inspect and obtain a copy of their FI. 6. Amendment of FI establishes a patient's right to request an amendment to FI. 7. Accounting of disclosures establishes a patient's right to receive an accounting of disclosures of FI made by a facility. 8. Administrative requirements include the requirement to have a privacy officer, workforce training programs, implementation of privacy safeguards, the process for individuals to make complaints, and establishment of anti-retaliatory standards for filing a complaint. Security Rule. The purpose of the HIPAA Security Rule is to establish standards that operationalize the Privacy Rule. There are 4 parts to the Security Rule. 1. Administrative safeguards are the policies and procedures to prevent, detect, contain, and correct security violations. 2. Physical safeguards include identification badges of personnel, authorized access to buildings or rooms limited to certain groups of personnel. 3. Technical safeguards include user identification and passwords, automatic log-offs, to protect the access and control of personal health information, FI. 4. Organizational safeguards such as business associate agreements, or BAAs. Cybersecurity. The United States Department of Health and Human Services Office for Civil Rights, OCR, 2021, reports the greatest incidence of breaches of FI to come from hacking. Other reported incidences are due to theft, improper disposal, unauthorized access disclosure, or loss. Cybersecurity, which includes hacking, is defined as the state of being protected against the criminal or unauthorized use of electronic data, or the measures taken to achieve this. Cybersecurity, 2016, as cited in Biederman and Dalzell, 2017. The Office of the National Coordinator, ONC, and OCR provide several resources, including guidance documents and educational materials to help healthcare organizations understand, implement, and assess compliance with the privacy and security of information systems. The resources can be found at Interoperability and Health Information Exchange. The electronic health record has provided many benefits to patients and the healthcare system. These benefits have increased the amount of data and information collected and used. But the use of this information is enhanced when it can be shared when and where it is needed. Interoperability allows for the sharing of information between disparate information systems. Health Information Exchange, as defined by healthit.gov, allows healthcare professionals and patients to appropriately access and securely share a patient's medical information electronically. Office of the National Coordinator for Health Information Technology 2018. Interoperability supports health IT systems to work together and is a component in Health Information Exchange. The value of Health Information Exchange is that patient information is shared electronically between providers and healthcare organizations. This sharing has decreased the number of duplicate tests performed, improved management of the patient, avoids readmissions, and helps to avoid medication errors. HIS PACS AI. Health Information Systems, HIS, are designed to manage healthcare data. The HIS allows for sharing of protected health information, or PHI, across the healthcare enterprise. The HIS typically includes data acquisition, repositories, and is responsible for management and transmission of the patient's electronic medical record, EMR. The HIS provides relevant information to the Radiology Information System, RIS, for radiology services. The RIS is responsible for management of imaging orders, scheduling and billing, and serves as a method of patient management and tracking, as well as reporting. The RIS typically communicates with the Picture Archiving and Communication System, or PACS. PACS refers to a networked group of computers, servers, and archives to manage digital images. PACS storage is mainly cloud-based due to the sheer amount of storage that medical imaging modalities require. The connection between the RIS and PACS allows for increased efficiency and ease of access to images. Artificial intelligence, AI, is the science of engineering intelligent machines and computer programs. AI encompasses a broad range of intelligent functions performed by computers and provides an opportunity to transform modern healthcare. Radiologic and imaging science professionals should become familiar with the common terms and concepts surrounding AI in order to facilitate improved engagement with these systems. AI's impact factors include precision, the ability to reduce errors, automation, or intelligent protocoling, augmentation, and an ability to view the patient holistically. Artificial intelligence and machine learning, ML, encompasses an extensive range of computerized technologies to solve problems in ways that imitate human thinking, but at a speed almost a million times faster. Machine learning is an extension of AI that can be defined as a method of data science that provides computers with the ability to learn without being programmed with explicit rules. Machine learning requires a training phase which is supervised by a human, a testing phase which is unsupervised, and a validation phase which seeks to prove accuracy. Many AI applications use a machine learning approach and are being utilized for radiology order scheduling, patient safety screenings, image acquisition, improved accuracy of patient positioning, and suggesting modified sequences on findings. AI is a useful tool in the radiologic and imaging sciences, and the algorithms, or complex mathematical equations, associated with AI are powerful. For example, the use of AI algorithms has provided ways to highlight incidental cases of pulmonary emboli, PE, on contrast-enhanced CT exams, identify and classify kidney cancer, as well as image reconstruction, automate protocols, and communicate findings. AI algorithms have also been implemented for non-image-based workflows and regulatory issues, and will continue to develop the way we deliver healthcare, specifically radiologic and imaging sciences services. Summary: Health information management is the profession built around the management of the health record and the data and information within it. Professionals in this field are tasked with ensuring the availability, accuracy, confidentiality, and the security of patient records to assure the quality and continuity of patient care. Clinical decision-making and financial reimbursement depend on the information contained in the health record. Health informatics has emerged as an interdisciplinary field. It seeks to improve outcomes, lower costs, increase patient safety, and promote high-quality services. The electronic health record is used to communicate information related to patient care, substantiate the care and treatment provided, assist with medical decision-making, support medical education and clinical research, and provide financial reimbursement to healthcare organizations. Interoperability supports health information systems working together and allows systems to share patient information when and where it is needed. Health information systems manage healthcare data. Radiology information systems manage imaging orders, scheduling and billing, patient tracking and management, and reporting. Artificial intelligence is a tool that supports the reduction of errors, more precise diagnoses, and the ability to view a patient holistically.